And thank you, Catherine, for your introduction. I will share the screen. Good afternoon and good evening, depends on what time zone you are. Today, it is my very great honor and pleasure to give this keynote speaker. And my topic is a little bit changed from the topic I given. Artificial intelligence empowering nursing care, state of the art, and the future development. My presentation will be divided into 3 parts. And I will start with why nursing needs to be empowered by AI. Well, today, healthcare are facing a lot of challenges worldwide, as well as in China. And I will just mention a few. One of the biggest challenges that we are facing now is COVID-19 pandemic. There have been more than 41 million confirmed cases with over 1.1 million cases. And the number are starting rising again because the winter is coming. In just the last 2 days, the confirmed cases and the death toll increased by 1 million people. And so nurses are in the most front line in combating COVID-19, therefore are in the most dangerous position. There were more than 1,000 nurses have died. And in the future, other new epidemics and pandemics will still emerging, and the old infectious diseases are still threatening the health and the lives of human beings. The second main challenge is NCD. NCD killed 41 million people annually. And in China, the situation is even more worse. NCDs is accounting for 89% of deaths in China. Currently, we have 450 million patients with NCDs. And we also have large numbers suffer from mental disorders, such as depression. While most of the NCDs are potentially preventable by modifying unhealthy behavior and lifestyles and reduce the risk factors. So let's take CVD as an example. And the advances of new treatment, including development of new drugs, only accounts for 47% of the death reduction, while improved CVD risk factors accounted for 61% of CVD death reduction. However, the prevalences of various CVD risk factors are still very high in China, in Europe, and also globally. The third big challenge that healthcare, especially nursing, is facing is the aging of population. In China, at the end of 2019, our elderly population reached 247 million, and the growth rate is about 3% for every 10 years. So the challenge for elder care is reported basically from a large number of people with disability. And in China, we currently have more than 40 million elderly people with disability, which causes the most of the burden of elderly care. So in all the above mentioned healthcare challenges, nurses and nursing can and should play an important role and a critical role in combating NCDs, in combating COVID-19, tackling NCD, and providing quality and integrated care for elderly patients. And the WHO has recognized that nurses and nursing are critical to deliver on the promise of leaving no one behind and the global effort to achieve the SDGs. With the increased demand for nurses and nursing from both public healthcare and the public sector, the nursing workforce faces challenge too. It is estimated that there are about 5.9 million nursing shortages globally. Also, we are lack of effective interventional methods and the technologies in preventing and controlling new epidemics, tackling NCDs, and keeping the elderly healthy as long as possible. Fortunately, with the largely improved computational power, increased data, better algorithm, and the broad investment, the capacity of artificial intelligence have been increased in the last decade, especially in the area such as simulated human recognition and cognition, reasoning, problem solving, natural language processing, etc. Especially, they have the obvious advantages, such as they are patient and they could be available on 24 hours and 7 days, and they are ubiquitous and could provide the care uninterrupted. And they can strictly follow the rules, therefore improve the adherence to the clinical guidelines. So what are the main AI applications that are implemented in healthcare and in nursing in China? Well, 8 main AI applications in healthcare in China has been identified. Among them, the 3 areas, public health, health management, and the robotics, are closely related to nursing, and I will give you some examples. As of August 5th, Chinese scholars have published 281 papers in 189 journals regarding the application of AI in combating COVID-19. These papers focused on 4 areas. One is AI-assisted diagnosis and treatment, and the modeling and analysis, simulation and the prediction, and the intelligence robots, information platforms. And I will provide a little bit more information regarding what we are doing or we did in these 2 fields. Now, in terms of AI robots, they use the cloud-based intelligent robots to assist in combating the pandemic. Hospitals and public places in large cities in China have introduced the AI robots to relieve the shortage of workforce and reduce the risk of infection. And there are 3 types of robots. For the delivery robots, it is used to deliver foods to physicians and the nurses in workplaces and to the people who are in quarantine. There are also clean and disinfection robots developed to sterilize rooms using disinfectant and UV light and help to promote hand washing. We also deployed the temperature-taking robots with facial recognition in some institutes and public places. These robots can take temperatures in defined areas to monitor and detect potentially infected persons. In terms of information platforms, It uses big data and AI-based methodology to establish information platforms for epidemiological interventions, etc. For example, in May of 2020, there was a small outbreak of COVID-19 in Beijing, during which the originating location of the infection was shortly identified, which is the Xinfadi food wholesale market in Beijing. By using big data, location, contacting, and traveling and tracking system, every single person who possibly went to the market or the surrounding areas, or even just pass the market when they're taking a public or private transportation, such as subway, was identified, and a notification was sent automatically to that person for PCR testing. So in just a few days, people, Beijing completed more than 300,000 people for PCR testing. And by using location data and AI analyzing algorithm, it found that more than 2,000 people who went to the wholesale market had left Beijing, and they found their traveling trajectory and were also determined. By using AI-enabled location and the contact tracking system, the spread of the virus was under control in a very short period of time. Now, how AI can help nurses? There are many areas that AI can apply in nursing care. And I think those 6 areas are really the leading ones that they can provide additional values to nursing by using AI. Now, the power of data will be unlocked by using AI profiles and the tools to discover the patterns and distinguish disparities among different data sources, and therefore can help us determine how we can use these data to design personalized care and develop protocols and profiles for our patients and customers. And AI can tremendously help us to use data to arrive at situations and scenarios that can help us integrate evidence-based decision-making process and address the quality, safety, and the efficiency of nursing care. And AI can also help us to coordinate within our healthcare team, especially interdisciplinary healthcare team, and faster communication, as well as making the communication more effective and accurate. And definitely, AI is helping patients to improve their engagement experience. So for example, eye care system, which was developed by my research group, collaborated with an IT company for CVD development, for CVD management after the patients are discharged from hospital. We developed this AI-assisted tools because the interventions for modifying behavior-related CVD risk factors are unsatisfactory. And there are a lot of reasons, and I'm not going into details in that. Basically, the eye care system targets on modifying 4 main CVD risk behavioral factors. And we developed a set of interventions that will tailor the patient's specific health status unhealthy lifestyles, habits, and preferences. Now, before the patient are discharged from the hospitals, nurses will conduct an initial health assessment, including lifestyles and all the determinants that will moderate or mediate the health behavior changes. And a summary of their health data and the care plan, including the goal of controlling their risk factors, are uploaded into the systems before their discharge. After the discharge, they will work with their nurses to set their personalized goals in change unhealthy lifestyles and the action plan in achieving these goals. Health data are monitored, such as symptoms, lifestyles, by either manual entry or wearable devices, and the personalized feedbacks and interventions will be sent to the patient automatically by the system after the system receives the monitored data. And the patients can also check their progress and make their own decisions accordingly. Also, a knowledge graph was developed for a built-in AI automatic counseling. Patients can ask questions regarding CVD diseases and the medications at any time, and will get an answer automatically and immediately. You can see that. And they also can request a professional counseling from a real nurses. So here, test here, and then you can ask questions and get counseling from a real nurses. Now in Canada, an AI integrated system aimed at early warning and the prevention of chronic disease risk were also developed to help citizens in self-assessing their risk factors for chronic diseases and conducting self-monitoring, as well as assisting their self-management. What they did was that they developed a chronic disease knowledge model using knowledge graph to analyze the total risk in developing 5 chronic diseases using observed risk factors. In China, as I mentioned, we have a high prevalence of mental disorders, and the suicide rate is 9.7 per 100,000 population. And there is a mini blog called Weibo. It's a popular Chinese social media. When the owner of the Weibo blog account died from suicide, it became a place that people with depressive disorder to post messages of their thoughts and their feelings that they don't want to tell somebody else. Those accounts is called tree hole. Now, Huang and his colleagues and his research teams developed a web tree hole intelligent agent. They also call it intelligent robot for suicide monitoring and early warning by using tree hole knowledge graph and the semantic analysis to detect the level of suicide risk. Once the detected suicide risk reaches 6, a message will be sent automatically to the tree hole operate rescue team to activate the rescue process. Now,
in today's hectic world, it's getting increasingly difficult to remember what truly matters.
A family,
the health of you and your loved ones. But now someone can help. With his artificial intelligence, Pillow recognizes each and every member of your family and starts caring for them.
And the smart system, which is also developed by our research team, is a remote care system for elderly with the purpose to keeping the elderly healthy and safe at home. It is very similar to our eye care system in the design and architecture. And we put a lot of sensors both at the elderly old person's house and also the wearable devices to detect any unsafe situations and the symptoms and signs of their health status. So as we all are aware that Japan is a country with the highest proportion of elderly population, including the oldest older population. However, there is a severe shortage of care provider for elderly. So it prompted intersensory efforts towards robotic technologies in nursing practice for the elderly. So one of the researchers, her name is Tanioka, and the research teams tested the robot paper. It is a very famous Japan-made robot, act as a rehabilitation instructor in rehabilitation facilities and mediated by human nurses to guide elderly people conducting routine exercise in rehabilitation center to improve their physical function and the quality of life. So you can see the robots is instructing the elderly to do the exercise.
Irritating him during the shooting
and
of this
Japan
film.
is also developing elderly care robots to assist nurses and care providers for this carrying, transporting patients robots.
Ryman really should have let go of the doll. For some incomprehensible reason, he holds on tight.
And also this is the robot
until
tape
capability
to accompany the elderly and to
One of the
reduce
most famous
the
of these
loneliness
is Paro.
of the elderly.
And
also, healthcare, nursing, and rehabilitation robotics are also advanced rapidly in China. There are 4 types of medical robots in China, and among these, rehabilitation robots account almost 50% of the medical robotic market in China. Now, we all know that there are 3 types of AI applications: weak AI, general AI, and super AI. And we are currently in the very beginning stage, which is weak AI stage applied in nursing care. So what are the barriers for developing general or super AI for nursing care? And what is the overall future development of AI in nursing? Well, there are definitely some systemic challenges, both internal and external, that can be really hindering barriers to move forward the integration of AI strategies in nursing. Now, from my own experience, I think data, technology, issues regarding trust, policy, regulation, and ethics are the main challenges that we are facing in deployment of AI strategy in nursing. Now, because data is the foundation of machine learning and deep learning, so data is critical to AI integration in nursing care. However, we are currently lack of high quality patient data for nursing care. And we almost no daily lifestyle, no data on lifestyle, healthy behavior, physiological and psychological data from our patients and from our customers. And also we are lack of standardized nursing language and data sharing and utilization. Technologically and currently, IoT measured data are not very reliable and lack of accuracy. And also deep learning are encountering data bottlenecks, and the algorithms are usually biased. And also weak AIs cannot create values and meet the complex nursing care needs. And the low intelligence usually only have one functions, but the cost is very high. And thirdly, we're also facing trusting issues, both from our customers and also from inside our medical and the nursing side. And the fourth challenge we are facing is that the policy regulations for AI application in nursing care are not in place yet. And the ownership and the utilization, security, and the privacy of the data are difficult to balance. So what are the next generation of AI in nursing care? Well, the next generation of nursing care will be all about the digital application. And we could have more accurate and connected sensors, enabling devices and wearables. And these are actually started almost 4 years ago on a very limited scopes. And it is going to be booming extensively due to the COVID-19. As we all know that for the last 10 months, the COVID-19 has been the powerful driving force in promoting the application of telehealth, telenursing care. So we probably gonna use more and more connected sensors, enabling devices to allow patients staying at home and monitoring their health status, their lifestyles, so they don't need to even go to the hospital and stay healthy. So by doing that, we will have more reliable and accurate data, and we'll have advanced analytics so that will promote the development of strong AI. So in this article published in Harvard Business Review, it talks about 10 AI applications in healthcare in the year 2026. And among these 10 promising AI applications, 5 of them are very close related to nursing. Especially virtual nursing assistants. It is estimated that it will save about $20 billion US annually by saving 20% of the time nurses spent on patient maintenance tasks in 2026. Now, with that, I will finish my presentation. I thank you all for your attention.
Thank you very, very much for this great presentation. I wonder if there are any questions from the audience. You can use the Q&A button if you're attendees.
Actually, I think the Professor Wu's talk is really great, very insightful about the AI and the new technologies, innovations in the nursing practice. It seems that AI and even the robot can be an important technology to be used. So can you see that there's any new, let's say, besides that use for the, let's say, infection area to use robots, and what kind of areas like other things can be more efficiently used the robot and AI?
In terms of robots, because for the all procedures that nurses will provide to the patients, it's very complicated and very individualized. So currently, although there are some nursing care robots, just as I show you, carrying transported patient from beds to the chair, or from beds to the bathroom. However, it's still in the research stage and not used in the real world yet. But I'm very optimistic that with the advance of the technology, both we have more data, we have more accurate algorithms and data materials, and also technologies. We can develop some robots that can take some of the nursing routine tasks that do not need a lot of human-to-human contact.
That's great, thank you. Actually, like robot and all other equipment that can be used in nursing area, the robots and the equipment can be a kind of hardware. It can have some capabilities, but the intelligence in this kind of devices, we call them, or equipment, can be more important. They can do one thing if the intelligence is low, and if we install more higher intelligence or develop better algorithms, they probably can, with current mechanical or electronic capabilities, they can promote their functions or powers to do better things, I guess.
I totally agree with you. And as I in my presentation, there's a robot. They test the effectiveness of robot to guide the exercise, and they rate the intelligence of that robot is 0 according to the standards of the intelligence of robots. So the intelligence of the robots are the key of if the robots can bring in value to nursing care, to nurses, and to our patients, and also our customers. And one of the most important things is that currently we are lacking of data, high quality data, and we don't have, sensors to collect more accurate daily data about physiological status, psychological status, and also their life styles, their life status. So if we can have more sensors, and the sensors could be used together to collect more data and more accurate data, and then we can train more intelligent machines to do the work.
Yeah, sophisticated machines to improve or enhance their capabilities. May I ask one more? Or we have questions from audience? I don't want to. Maybe we can give the opportunities to the audience.
We had a question from this morning session, which Professor Wu might be able to answer. I'll give I will allow Eleni Paximadi to talk and ask her question if possible.
Okay, I will try.
Let me.
Good morning, good evening. Thank you very much. I really enjoy all sessions. Actually, I had a morning question. I would really be interesting in general to know about how you collect data from patients. Do you usually use questionnaires that the patient could apply or feel free to fill it by himself, herself, or do you usually do it with a doctor or a nurse, or can he do it or her only in hospitals, or can he apply via internet? Thank you very much.
Thank you for your question. Depends on what kind of data we are collecting and where the patient are. For instance, if the patients who are hospitalized in inpatient hospitals site, or they visit the physicians in the clinic or community health centers, then nurses will collect the nursing data, and the physicians will collect the medical data from the patients. And if the patient is staying at home, and because we have the 3-level hospital or healthcare providing systems, the third tertiary hospitals and the secondary level hospital and the third level hospital, which is community-based community health center. So for the people who live in the community, who live at homes, and the community health center will collect their health data into the systems. So we have a electronic healthcare systems collected by community health care providers. Nurses will collect the nursing data, nursing related data, and also the physicians who work in the community health center or township small hospitals will collect medical data, and also for the physical therapist or social workers, they will collect their data and then merge it together, because every citizens will have their own database.
Thank you very much for the important information. Sorry, I forgot to talk about myself. I'm actually a board member of Pan-Hellenic Alliance of Rare Diseases. So as you can understand, we have many rare patients. Furthermore, I am a patient myself. I have multiple sclerosis. And I'm also a molecular biologist, virologist. So I have, let's say, a dual status. So I'm very glad for sharing the data. So we could use it in Greece too. Thank you very much.
Thank you.
We will take one last question because there is time. Thank you, Lenny, for this. I'm reading from the Q&A box. Thank you for the wonderful presentation, Helen. That goes to you. Do you also see relevance for involving midwives in China, particularly in the deference to establishing networks to improve perinatal health, engage women for data collection, etc.? Please.
Okay, thank you for the question, and also thank you for the comments. Yes, we involve midwives, but in China, our situation are kind of different from the rest of the world. Because in China, all the births are given in the hospital, and we have OB and GY physicians who will do the labor and delivery for delivery the babies. So in China, not like in the rest of the world, midwives are not separated from nursing, and currently we don't have the separate license for midwives. And so for the midwives, they need to take the nursing licensure examination first. And then after they practice in the field of midwives, and they will promote it as a specialty and nursing. So for instance, in my school of nursing, we have we have two programs. One is a bachelor degree for nurses, and the other one is the bachelor degree for midwives. Did I answer your question?
Let's, I assume that you did. I don't know if Elena wants to talk.
Hello. First of all, thanks for a very nice presentation. I'm the Vice President of Health Technology Assessment in the European Public Health Association, and I don't get very excited easily. So this is very exciting. I'm aware of the system in China, and there's some similarities in other countries, but the trouble is that perinatal health extends before birth, 1 year or more, it's planning, and also more than a couple of years, the first few years of the child's health. And there, I think we're discussing more community, a role for professionalization in community. So do you think that this should evolve in China, how midwives are practicing? Because in Europe, we're transitioning to a role where they play an active role in the family. And for us, this is relevant for data collection, for how families live, but also for public health interventions, particularly in terms of behavioral change. So thanks. If we have 1 minute to answer that, Catherine, that would be also wonderful. Thank you.
Thank you. I think with I think 3 years ago we started a two-child policy. As you all know, 3 years ago we have one-child policy, and then we found that our population and our birth rate going down. So we started a two-child policy. So with that two-child policy, the birth rate is increased. So all of a sudden we have found that we have the shortage of midwives. So after that, a lot of nursing schools started midwifery programs to prepare midwives in their school of nursing, and from my point of view, currently the births were still given in the hospitals, and the midwives will still stay in the hospitals instead of in the community, because the community and not like in the United States or in Europe, birth can be given at home. In China, it's not allowed to give birth at home. Not allowed, but because we want to reduce the death rate or mortality rate of newborns.
Thank you. I think this is a source of good discussions to come. I would, if we were live, we would actually clap our hands for Professor Wu. Thank you very much for the inspiring conversation.